Thank you, Dr. Darnell, for that introduction. So today I get to talk about something I'm really passionate about, which is movement as a form of medicine. So when most people think about medications, they think about how a specific medication they're going to take might act on their body, right? Some receptors and change their physiology. But not many people think about how movement changes their physiology. So I'm going to be going over some of the mechanisms behind that and how, if you're ready to explore movement, physical therapy would be a good place to do that. So when I'm working with my patients at physical therapy, some common questions that I get from them is, what contributes to my back pain? Another question, how can I start moving again or get back to the activities that are important to me? And how can physical therapy help me? I've been to physical therapy before. It wasn't helpful, or it made you worse. How is this time going to be different? And then how can I find resources or the physical therapist that is right for me? All right, so what contributes to back pain? You heard Dr. Mackey talk about this already, but I want to just emphasize that genetics, right, play a role in how your spine is made up, your structure of your spine, the activities you do at work or your postures can play a role, the lifestyles that you engage in or how active you are can actually be a preventative factor for back pain. And then things like mood or even social factors can also play a role in your recovery. So it's complex. I'd like to point out on this slide that many people kind of focus on that, you can't really control your genetics yet, they're working on it, or things like your age, but things that physical therapy can work on with you is things like your activity and your postures. And then the other team members that Dr. King had mentioned would work on the other factors. Okay, so these are some important facts that I want to cover that patients often come in with, and that's that the degree of injury to your tissues does not always equal the degree of pain. So an example of this is a paper cut. Paper cuts hurt a lot, but they're a very small amount of tissue that's actually injured. And what we know is that the tissue, right, is only one signal that goes up and contributes to your pain. So this is important because all those other factors might be helpful to address them. And that pain, everyone experiences pain individually. You heard about this earlier. And that rarely is back pain dangerous. So I want to hit this one because lots of people are so nervous about making their pain worse, is that when you go to the doctor, less than 1% of the time is back pain related to something like cancer or a tumor, which means that for 99% of the time, movement will probably be part of your plan, okay? Okay, so why can movement be so painful? This is a hard one, but you may have heard from someone not to move, right? They're like, oh, don't do that movement again, it was painful before. That kind of makes your muscles guard, and it makes your pattern of movement change the next time you try. Okay, people with chronic back pain, we actually know that they have their muscles fatigue sooner when they try to move compared to people that don't have back pain, and that they have more difficulty knowing where their body is in space. So if you test them, they're not sure how far forward they're bent or how their muscles are working or even if they're relaxed or tense. So this is something that you can work on with your physical therapist. And that fear of movement, worry that you will injure yourself or make yourself worse, or the lack of confidence in your body, if you're concerned about the structures of your body not being able to handle the movement, that will also influence how you do with movement. And that we know that lack of movement or rest, so resting just even 11 days can make it so your muscles start to get a little bit weaker. So when people try to use rest to kind of help calm their symptoms down, that prolonged rest can make it harder for you to move when you try again. Okay, so we already talked a little bit about the brain and its role in pain, but I like to bring that back to how does movement change your brain? And the answer is it provides your brain with feedback on what is safe to do and what is easy to do, right? So this allows for what we call motor learning. So when you first learn to tie your shoes, when you first learn to walk, when you learn a new sport, all of that takes practice. And that practice and that movement gets stored in your brain for next time so that when you try again, you can build off of that and it becomes easier. I don't know how many times it took you to learn how to tie your shoes, but it took me a few times. So that practice makes it easier. And that we know that it restores your body awareness, or how to move better the next time you try. And that if you don't practice, right, if you only go practice once a week, you don't get those gains as much as you would if you would do it gradually and persistently. So the more frequent practice gives you more feedback for next time. Okay, so movement changes your brain, but this is something that physical therapists love, is that how does movement change your tissues? And this is what I'm talking about earlier, the mechanisms behind how movement is medicine. So we know that for movement improves your muscle strength, right? It makes your muscle cells get bigger. Also, for your bone, there's a picture on the right-hand side of the screen, you can see that's the bone kind of in the vertebrae, and it's got lots of nice structures like a building, right? Lots of supports, and that compression actually makes those supports grow. So if you are walking and you're doing some sort of loading, that's gonna make your bones stronger. And the picture on the left is some pictures of vertebrae stacked up, and you can see there's little joints in the back of them, and you can imagine that you've got lots of little knees stacked on top of each other in your back, and that motion is lotion for these joints. So I like to say that, think of an oil lubricated for a joint. Your movement makes it so that they can slide and glide past each other more easily, so you're less stiff. And if you stop moving, they can get a little bit stuck and make it harder for you to move. So that's how some different tissues that do better with movement. Okay, so now you would want to restore your movement. How are you going to do this? So patients that I work with in clinic find it helpful to go over through some thoughts, such as motion is lotion, like I already mentioned, or it may be painful, but this movement is safe, or movement can make my back move more easily, okay? And then when they're ready, it's important to try a variety of movement. So in physical therapy, we get to analyze all different forms of movement, and that's how we can help you best find the movement that's easiest for you. It may be hard for you to do movement standing or lying on your back or on your side, and so we're supposed to be there to guide you through what you can do. And then this is the whole purpose of the picture of the mirror. So the mirror allows feedback for your brain to take that, and when you look at that, it gives you feedback that it's safe and that you can do it. And so they've found that people that have chronic back pain, when you add that mirror for feedback, it actually reduces their pain compared to no mirror. It can be helpful to find an activity that you enjoy and have others support you with that, so that when you get stuck or you're in a pain flare, you have a little bit of support about trying to do that activity again. And then making that movement a daily habit, right? So your brain and your tissues can really benefit from the things that you're doing. Okay, so I would like to invite all of you, if you're open to this today, to explore a movement experience. So I'm gonna lead you through a little bit of movement. It's all sitting, so you can stay in your chairs. But I'm going to kind of have you kind of take your attention to your body for a moment. And just kind of find a place on the seat where you're somewhat comfortable. And just notice first the amount of pressure that might be on your bottoms. And if you would like, you can take a hand and kind of place it on the small of your back if you're able to reach that. And we're going to do some motions of the spine. So kind of if you imagine the small of your back, kind of, I'm going to step away for a second, kind of relaxing, okay? Relaxing into the chair. Maybe it'll touch the back of the chair. And then as you breathe in, try to think about your belly coming up and that back kind of arching. So you're gonna go between a slouched and kind of an arched position. So breathe, exhale, and kind of relax the back, maybe again feeling the pressure change underneath your legs. And then come up and kind of bring your back forward. Good. And then relax, and then try to let your pelvis kind of sink back into the chair again. And then the next movement is going to be coming forward to try to reach towards your toes. So if you have space for this, you can try this out. So just reaching forward and imagining your spine kind of elongating as you reach towards your toes, and making sure that you breathe out and let your neck relax. Good. And then when you inhale, you can come back up. Good, and just kind of feeling the difference between that big stretch versus the smaller stretches. And then we're gonna do 2 more movements. So you're gonna try to bring your right elbow towards your right hip, so your right shoulder is going to fall down to the right, and you're going to be a big stretch on your left side. Good. And then inhale, and you can come back up. And as you exhale, you can go out to the left side, kind of letting your left shoulder, and just noticing the difference between the weight on the hips and the stretch on your side. And then inhale and come back up. Perfect. So I think that kind of exploring that movement experience and just noticing what your body feels can be helpful every time you try a new movement there. All right, so let's say you're ready to explore movement with your physical therapist. What's going to happen when you go see the physical therapist? So the physical therapist is going to take a history. They're going to talk to you about the activities that you used to do that you're not doing anymore, right? What's important to you. They're going to go through some physical examination, right? They're going to examine your back as well as different joints around your spine, the strength of your muscles. They're going to do a lot of education. They're going to talk about maybe why your physical therapy in the past wasn't helpful. Maybe you were doing an old kind of rest and let your tissues heal model versus kind of graded activity and pacing. They're also going to go over a movement homework, right? You're going to have homework to take home, some movements that are going to help you move towards your goals. And they're going to make a plan for you to get back to the activities that you used to do. Okay, so this slide just covers the physical therapist toolbox, so different things that you might receive while you're at physical therapy. Now, the things on the right-hand side of the slide are things that feel good, right? Who's had a massage and had it feel good? Good. Yeah, you're human. Touch helps decrease pain, so that's a good thing. However, we know that the long-lasting effects of that just aren't there, right? It feels good, and then you try to move again, and it's difficult. And so if you add the things on the left-hand part of the slide, so the active exercise, right, your specific movements, pain education, as well as maybe some postural awareness exercises, those things make it so that you recover your function better, right, than the passive things on the right-hand side. So both are great, but I try to emphasize to people that this might be not what you had at physical therapy before, maybe the reason why you didn't gain as much of the function that you would have liked. All right. So this slide just covers resources. So how can you find the physical therapist that's right for you? So moveforwardpt.com is a great resource of success stories that patients have had with their physical therapist. So this would be good kind of saying, oh, this is what that person did at physical therapy that was helpful for them, right? We all know that everyone's pain is different, and some people need different approaches. And then apta.org is a site you can go to and enter your zip code. So you can find physical therapists and their specialty, so back, shoulder, right, musculoskeletal conditions near you, and kind of help find, again, that person that's right for you. Because physical therapy is, right, it's a relationship between you and the provider. So it's important that you know you trust your physical therapist and that you have a good relationship with them so you can make the gains that you need. Okay, and I believe we're taking Q&A, and hopefully all the microphones are working.